Hello everyone and welcome to my YouTube channel. So the topic I'll be discussing today is Torsade point. So Torsade point is rapid polymorphic ventricular tachycardia, and why I'm saying it's a ventricular tachycardia, because if you can see in the ECG there is no preceding P wave. It means the electrical impulses are not generating from sinoatrial nodes, and it is thought to be generated from multiple ectopic foci present in the ventricles and which are causing tachycardia. It is characterized by undulating rotations of QRS complexes around the ECG base. So again, look at the ECG. You will see that the QRS complexes are twisting around isoelectric line. Hence the name is Torsade point, which means twisting of point in English. It is a complication of prolonged ventricular repolarization, prolonged QT interval. So it is one of the complication of prolonged QT interval. And how do we calculate QT interval on ECG? We take the start of Q wave till the end of T wave, and it reflects ventricular depolarization and repolarization. So you will see prolonged QT interval. What are the causes of increased QT interval? It can be congenital prolonged QT syndromes, and some medications like tricyclic antidepressant, anticholinergics, lithium, quinidine, procainamide, these all can increase the QT interval. Brugada syndrome is another genetic cause of prolonged QT interval. It is a genetic disorder due to defect in sodium channel function, and it presents with polymorphic ventricular tachycardia or sudden cardiac death. And ECG will show right bundle branch block and ST elevation in lead V1 and V2, but not usually with prolonged QT, and treatment is always with implantable defibrillator. So torsade is mainly asymptomatic, but if there is sympathetic stimulation, that is increased adrenaline either due to physical exercise, stress, anger, fear, then it may lead to fainting, seizures and sudden death. It can cause sudden death at night in seemingly healthy individuals. So how do we treat it? We treat the underlying cause. Acute treatment is with IV magnesium, which is the drug of choice. Alternative agent is IV isoprotrenol. Atrial pacing will suppress the arrhythmias, because pacing increases the heart rate, which in turn will shorten the QT interval, thus terminating the torsade. Chronic treatment with beta blocker is important. It is the first line drug in congenital long QT syndrome. Beta blockers are contraindicated in acquired long QT syndrome because bradycardia caused by these drugs can precipitate the torsades. Left stellate ganglion block and implantable cardiac defibrillators can also be used. I hope you learned something from the video, and if you do, please like my video and subscribe to my YouTube channel. And thank you so much for watching.